CICU devices.
Levitronix CentriMag. Key clinical concepts. The Levitronix CentriMag is an extracorporeal temporary mechanical circulatory support system designed for short-term ventricular assistance in patients with acute cardiogenic shock and severe cardiopulmonary insufficiency. The system uses a centrifugal blood pump with a fully magnetically levitated rotor, eliminating mechanical bearings and seals, and thereby reducing friction, wear, and blood trauma. This design contributes to a low risk of hemolysis and thrombus formation and allows reliable high-flow support. The pump is capable of delivering flows approaching 10 liters per minute, enabling full circulatory support in critically ill patients. It is approved for circulatory support durations of up to approximately 30 days, with reported safe use extending beyond this timeframe in selected cases. The CentriMag is a continuous flow centrifugal pump featuring a magnetically levitated rotor that operates without mechanical bearings, friction, or wear. This bearingless design eliminates heat production, minimizes blood trauma, and prevents mechanical failure. The rotor surface is uniformly washed by blood flow, reducing stagnation and turbulence within the pump chamber. Mechanical gaps exceeding 0.6 mm minimize shear forces, thereby reducing hemolysis. Blood enters through the inflow cannula, passes through the pump chamber, where the rotating impeller generates centrifugal force, and exits through the outflow cannula at elevated pressure, generating forward flow through the extracorporeal circuit. The magnetic levitation system maintains rotor position and rotation without bearings or seals, minimizing blood trauma and thrombosis risk. The pump has a priming volume of 31 milliliters and can generate flows up to 10 liters per minute at rotational speeds up to 5,500 revolutions per minute. The CentriMag system is indicated for temporary circulatory support in various acute cardiac failure scenarios: post-cardiotomy cardiogenic shock, acute myocardial infarction with cardiogenic shock, acute decompensated heart failure refractory to medical management, myocarditis with hemodynamic compromise, primary graft dysfunction following heart transplantation, right ventricular failure after left ventricular assist device implantation, and bridge to recovery, bridge to decision, bridge to durable ventricular assist device, or bridge to transplantation. One of the main advantages of the CentriMag system is its versatility, allowing multiple cannulation strategies and support configurations. The same pump and console can be used across different setups. Left ventricular support can be achieved with inflow cannulation at the left atrium, left ventricular apex, or right superior pulmonary vein. The outflow is typically directed to the ascending aorta or axillary artery. For right ventricular support, inflow cannulation is performed in the right atrium, including bicaval configuration, or right ventricle, with outflow to the main pulmonary artery, either by direct cannulation or via a graft anastomosis. An alternative approach involves the use of the Protect Duo dual lumen cannula, originally designed for the tandem heart system, which is compatible with the CentriMag pump and tubing. Biventricular support can be established by combining the configurations described above. Finally, an ECMO configuration can be implemented by incorporating a membrane oxygenator into the circuit. This flexibility enables adaptation to a wide range of clinical scenarios without requiring significant changes in equipment. The CentriMag circulatory support system consists of several integrated elements. The main components include the disposable centrifugal blood pump. The pump consists of a disposable pump head containing a rotor that is fully suspended by a magnetic field eliminating the need for mechanical bearings or seals. This contact-free design minimizes friction, heat generation, and areas of blood stasis, thereby reducing the risk of hemolysis and thrombus formation. Blood enters the pump through the central inlet and is propelled radially outward by the rotating impeller, generating flow through centrifugal force. The blood is then directed toward the outlet, creating a continuous, non-pulsatile flow. The motor magnetically drives the pump rotor. The motor houses the pump and magnetically couples with the rotor inside the disposable pump head, enabling contact-free rotation. This motor generates a controlled rotating magnetic field that interacts with the magnetically levitated rotor housed within the disposable pump head, enabling contact-free transmission of motion. The control console regulates pump speed and monitors system performance. The console is a microprocessor-controlled unit responsible for generating the motor drive signal, regulating pump speed, and continuously supervising system performance. Pump speed is controlled through the console, which adjusts rotor rotation to achieve the desired flow. The CentriMag system includes a bedside monitor that provides real-time visualization of key operating parameters, serving as the primary interface for continuous clinical assessment. This display is integrated with a console and is designed to present essential information in a clear and accessible format at the point of care. Flow monitoring is typically performed using an external flow probe that provides continuous measurement of blood flow within the extracorporeal circuit. This sensor is typically positioned on the outflow tubing and operates using ultrasonic technology, allowing non-invasive flow measurement without direct contact with the blood. It also incorporates pressure sensors to monitor pressures through the circuit. These sensors are typically connected to pressure monitoring lines placed at strategic locations, such as the inflow and outflow segments of the circuit. The cannulas are the component inserted in the patient's vascular territory. Drainage cannulas are designed to withdraw blood from the patient's circulation and direct it to the pump. Return cannulas take the blood back to the patient. Cannulas manufactured by Abbott are specifically designed for use with the CentriMag pump. They are available in various lengths and diameters to accommodate different patient anatomies and support configurations. In addition to Abbott's proprietary cannulas, the system is compatible with a wide range of alternative cannulas from other major manufacturers, including Medtronic, Edwards, and Maquette. This compatibility is possible because the CentriMag tubing system uses standardized diameters, allowing safe integration of cannulas from different brands without compromising circuit integrity. Clinicians can, therefore, select the cannula that best fits the patient's anatomy and clinical requirements, while maintaining the benefits of CentriMag support. For right ventricular support, the system can also accommodate the dual-lumen cannula Protect Duo, originally designed for the tandem heart system. And finally, the tubing system that connects the inflow and outflow cannulas to the centrifugal pump, forming a closed circuit for blood circulation. The tubing is designed to be biocompatible, minimizing blood activation and reducing the risk of hemolysis and thrombosis during short-term mechanical support. The CentriMag circuit uses tubing with a standard diameter of 3/8 inches. Clinical management of patients supported with the CentriMag system requires continuous monitoring of hemodynamic parameters, pump speed, and circuit flow. Close surveillance for complications such as bleeding, infection, hemolysis, and thromboembolism is essential. Hemodynamic optimization involves adjusting pump speed to ensure adequate systemic perfusion without ventricular collapse. Pump speed and flow can be readily modified using the console controls, allowing rapid adaptation to changing clinical conditions. Achieved flow is dependent on both preload and afterload. Therefore, the clinician must ensure adequate preload and appropriately manage afterload to optimize device performance. Anticoagulation strategies vary between institutions, but systemic anticoagulation is generally required to prevent thrombotic complications. The device design is associated with a lower risk of thrombosis compared to other temporary mechanical support systems. Continuous monitoring includes pump speed, flow rate, and key hemodynamic parameters. In addition, echocardiography plays a central role in evaluating ventricular loading conditions, cannula position, and potential cardiac recovery. While the CentriMag system provides effective short-term circulatory support, its use is associated with potential complications that require careful monitoring and management. Hemorrhagic complications, including surgical site bleeding or cannulation-related vascular injury, are among the most frequently observed and may necessitate transfusion or surgical intervention. Thromboembolic events, although reduced by the device's magnetically levitated pump design, remain a risk and necessitate systemic anticoagulation and vigilant circuit surveillance. Hemolysis can occur due to high shear stress, improper cannula positioning, or kinking of the tubing, emphasizing the importance of careful circuit assembly, appropriate cannula selection, and regular monitoring of plasma-free hemoglobin levels. Infection is another critical concern, particularly at cannulation sites or along the extracorporeal circuit, requiring strict aseptic technique and early recognition of local or systemic signs of infection. Mechanical complications may include cannula malposition, kinking, or dislodgement, which can lead to inadequate flow or hemodynamic instability. Finally, pump dysfunction due to thrombosis, motor malfunction, or air entrapment, although rare, can also occur.
If you've enjoyed our video, please press the like button and subscribe to support us so we can continue creating quality content like this.